help them to move well, live well. We get a number of people that are coming in with issues regarding their knee, and they're wondering if they have a meniscus tear in the knee. Well, there are 2 tests that you can do at home that are weight-bearing tests, in other words, kind of like, quote, real-world tests that you can do at home, and you can do them by yourself. You don't need another person to do it for you. The couple of things, though, you want to make sure you have plenty of support, because if you're having knee pain and stuff, you want to make sure you can do this in a door jamb. You can have a sturdy chair to hold on to. I'm going to do this, in between the squat rack, so I have a post to hold on to. But the idea behind this, you want to make sure you have the support, because if it is a positive, your knee can give and it can be very dangerous. So make sure you have some sort of support or another person around to help you with this. But you can do this at home by yourself. The first one is the Aegis Test. That's E-G-E. I don't know if I'm pronouncing that correctly, but it's E-G-E'-S, Aegis Test. And that test, what you do, so what you do is you stand, kind of like if you're going to do a squat or something, so kind of an active squat. So your feet are just outside shoulder width, or just outside shoulder width. And at first, what you're going to do, you're going to internally rotate. See this? You're going to internally rotate as far as you can, your hips, your knees, and your feet, just like this. And you're going to come down into a squat. And this, as far as you can go. Now, you get to a point where you can't go very much farther than this, but this tests the lateral meniscus. You can just imagine the lateral condyle of the femur on this side is pushing into the lateral meniscus. And positives for this is obviously pain. And obviously if you feel pain as you do this in this area, then it's a good indication that you probably have a meniscus issue in the lateral meniscus when you do this. Or clicking in that side too. So pain or clicking when you do this on this side and or this side, depending on which is the involved knee, you have pain. Again, make sure I don't have meniscus issues, but make sure you're doing this. You can do it supported like this in a post or door jamb. So that's to test for the lateral meniscus. Now to test for the medial meniscus, the inside meniscus, you want to externally rotate. So as far as you can, you're going to have your hips externally rotated, the knees are out, the feet are out. See that? And then again, you're going to go down and do a squat. And this, you can kind of see, this pushes the medial condyle of the femur into the medial meniscus. And if you have a lesion, you want to go down to as far as you can go down. And positive is, again, positive if it's pain or some clicking in the knee. It's a good indication that you probably have a medial meniscus problem in that knee. So that's the Aegis test. The next test is called Thessaly. Again, make sure you're supported. The Thessaly Test. So this test you're going to have to let's say I have a problem with this knee. I have pain. I think that's a meniscus issue with this knee. So let's test the good knee first. So I'm going to stand just like this in the door jamb, or if you have a chair or whatever. And your knee is going to be just a soft knee. So let me just lift this. You can see my sexy legs here. So you're not locked out here. You're going to be about 5 degrees. So I call it a soft knee. So a soft knee. See the difference? Soft knee. So a soft knee, and I'm going to rotate this way as far as I can go. Rotate this way as far as I can go. And I do it 3 times as far as you can go. Okay, there's 2. And then there's 3. And positive for this is, again, if you have pain here or here, and or clicking, then that's a positive for a meniscus either here or here when you do that in the 20 degrees. Now, obviously now let's say that's just a test for the good knee. Now you're going to test the bad knee, and you do the same thing. So let's just say I have a problem with my right knee. You're going to do the same thing. Again, soft knee. Right? Soft knee as far as you can go, twist. Same thing over here, twist. Right? What's great with these tests, you do these 3 times. There's 2. And then 3, all the way to the end as far as you can go. Boom. Positive is if you have pain here or here, medial or lateral meniscus at 5 degrees with the soft knee. So there's another part to the Thessaly. You go to 20 degrees. So now you're going to come down about right there. See that? So kind of like a quarter squat, if you will. So you're going to come down to like a quarter squat like this. Knee is bent at about 20 degrees-ish. And now you're going to twist as far as you can go in the and to see if there's pain. Okay? Again, positives are pain or clicking in the knee. And once you feel pain or clicking in the knee, you can stop. You don't have to keep rotating. And same thing with the Aegis test. And once you feel pain and clicking, you just stop. You just go, oh, you don't have to keep squatting. You just get out of it, and you know there's an indication that there's a meniscus problem in your knees. So, 5 degrees and 20 degrees with the Thessaly. I'm going to rotate 3 times. Pain in the inside or pain in the outside, medial or lateral plane, is an indication you have a meniscus issue. Obviously, I don't have MRI vision, and I'm sure you don't have MRI vision too. So make sure you follow up. If you're getting positives with this stuff, make sure you follow up with your healthcare professional at home, in your area, for imaging studies, that type of thing. So that way they can make sure and get you the care that you need. Anyway, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button. That way you can stay in the loop with subsequent videos coming here in the near future. That way you can continue to move well, live well. Also, I know you know folks who are battling knee pain and they're wondering if it's a meniscus issue. Share this with them. These are 2 great tests, orthopedic tests, that you can do at home, self at home. Make sure you got plenty of support to help you. And they're great because it kind of tests real world, gives you that weight bearing. That way they can know whether or not they have a meniscus issue, because sharing is caring and knowledge is important. So share this with them. Also, give us a thumbs up, give us a like. It lets us know you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.